Well, it is a sobering statistic. 1 in 8 women will be diagnosed with breast cancer in their lifetime. Doctors say that early detection is key. So during this Breast Cancer Awareness Month, they're urging women to get their mammograms. In tonight's Health Check report, Channel 7's Beth Hunt has more on the life-saving exams available to women.
Breast cancer is the second most common cancer, but if caught early, it has a 99% survival rate.
Finding a breast cancer while it's small and is not showing any signs or symptoms is kind of the best thing and the most important thing we can do, and that's why we're kind of here encouraging mammograms.
Dr. Rachel Pahls, a breast radiologist at Baptist Health, says the main things she looks for are lumps in the breast, but that's not all.
We're looking at changes from your prior mammogram, if there's a new area of dense tissue or an asymmetry that shows up. Calcifications are a big indication, or can be a big indication of cancer, so we always look at those carefully.
Doctors also have other tools in their arsenal now, including automated breast ultrasound, or ABUS for short.
Mammography is still the best thing we have. We can offer every woman a mammogram, but sometimes when that breast tissue is so dense, the sensitivity of that exam just starts to plummet. That ABUS is kind of a game changer for detecting masses in that dense tissue.
Also available for high-risk patients, genetic testing and risk assessment for breast cancer. That's where advanced practice registered nurse Dr. Julie Turner comes in.
We're doing a little bit of blood draw, sending it off to a lab. It comes back in 2 to 3 weeks to see if you were genetically predisposed at birth to developing breast cancer. So it's very important if you have a family history, a strong family history of breast cancer, ovarian cancers, pancreatic cancers, colon cancers. Those are hereditary cancers that need to be analyzed to see if you are high risk for those cancers.
Any medical field that deals with cancer is challenging. This can be an emotional place, high stress with high stakes. And none of that is lost on these doctors as they work to provide the best care possible for women across the state.
Patients come here, with the anxiety of being told they have an abnormality, the fear and restlessness of a woman waiting for their biopsy results, and then that moment when the doctor tells you you have cancer. Those patients' worlds are just shattered in front of them, and we do that every day. And it never really gets easier, but once those patients kind of get a second to breathe and look up, they know we're here for them. We're going to tell them everything we can. We're going to hold their hand. We're going to guide them through this process step by step.
On your side in Little Rock, Beth Hunt.
All right, Beth, thank you. It is recommended that women who are at average risk of breast cancer get screening mammograms every year, starting at the age of 40.